Open enrollment is underway, but millions of Americans are now facing the prospect of much higher health insurance costs come 2026. A new White House proposal aims to extend subsidies under the Affordable Care Act for 2 more years, but Congress won't vote until mid-December. And if those tax credits do expire, families here in Georgia could see their premiums jump by thousands of dollars. New national data from the nonprofit group Blood Cancer United says more than 22 million Americans could face major premium hikes or lose health insurance altogether if ACA tax credits expire. An individual earning $28,000 a year would see annual premiums rise from about $325 to more than $1,500 without the subsidy. Families and older adults would face steep increases from roughly $3,400 more for a family of 4 to more than $22,000 for a 60-year-old couple. Let's dive deeper now with Katie Berge, Senior Director at Blood Cancer United. Welcome, Katie.
Thank you for having me this morning. Pleasure to be with you.
Yes, thank you so much. Let's start here, Katie, with the big picture. What happens on January 1st if Congress does not extend these ACA subsidies?
Premiums will spike for millions of Americans, including almost 1.5 million people in Georgia, right? And so we know that as an organization representing people with serious and chronic conditions like cancer, that going without health insurance is not a viable path forward. And so it's essential that Congress take action and take action now to extend this financial lifeline.
Katie, we understand more than 22 million Americans are at risk next year. Who gets hit first and hardest? Parents, seniors, small business owners?
Yes, the answer is yes, all of the above. For small business owners, the Affordable Care Act has been the only way that they can get high quality access to coverage. For people who are early retirees or just under Medicare eligibility, that's also them. We also know that people have families, right? And if a parent goes uninsured, it is almost twice as likely that the patient or that the child will go uninsured. So access to high quality health care is not something that Americans can afford to go without.
Concerning topics for sure, Katie. That'll get your blood pressure up. When you're talking about tariffs, inflation, families are already stretched by groceries, housing, and child care costs. So how do you see these health care premium increases compounding all that financial strain?
Right. You know, the thing about it is like none of us know when we're going to be sick, and we are already in a cost crisis, right? And so having insurance that backs you up, not only for your health, but protects your finances is really critical. And for cancer patients, the stakes are even higher. There is no such thing as a self-pay cancer patient, and losing this lifeline will force people to go without that care and put them into medical debt. We feel very strongly that everyone should have access to high quality and affordable healthcare that meets their needs.
Yeah, there are so many people, Katie, who rely on these credits, these subsidies. What should they be doing right now while Washington debates the future?
Well, first of all, Blood Cancer United encourages everybody to enroll in insurance that meets their healthcare needs. Second of all, it is time to raise your voice. Congress, both Republicans and Democrats, need to be encouraged to come to the table and cut a deal, and that includes the president. So right now, we would encourage every one of your listeners who's been impacted by this or know somebody who has been impacted by this to reach out to their congressional delegation. You can do that by visiting americanscovered.org and take action there.
You know, during this debate here in Washington, Katie, there are so many who are trying to figure out what the future does look like for these subsidies. If Congress doesn't act, what are the next steps here?
I mean, if Congress doesn't act, American families are going to be forced into impossible decisions. For cancer patients, this means fewer doctor visits, fewer treatments, and fewer hours with loved ones. And that's really not a tenable choice for people or anyone living with a chronic or serious illness. So, I'm an optimist here. I think that there's a path forward, but it doesn't go without buy-in and accountability.
What are the chances, realistically, Katie, that a deal gets done here in December? We get a vote. We've seen a federal shutdown, the refusal of lawmakers to come together and hash this out. What makes you think your optimist self can be fulfilled here and we'll have a resolution?
Because, optimism aside, these are people who rely on insurance. This is the system our government and our country has decided on. Cancer patients can't be left out alone, and I think Congress understands that. Stories about people who are impacted by this are really what will influence the debate moving forward, and people will remember who and when their health care was taken away.
Yeah. Katie Berge, thank you so much for your time. We will see how this plays out.